in Lamu, and in every one of our 47 counties. To serve without partiality. Every child, regardless of ethnicity, religion, disability, or background, whether male or female, must be supported with the same compassion and commitment. Even that young child who is not very clean, who has mucus running down their nose with very dirty clothes and not looking very pretty or very handsome, they also need the same compassion and commitment. And that is the call to all of us here. This is not just a policy imperative, it is a moral obligation. And then, after we have provided this, there is the responsibility that we take as government, as service providers, because this responsibility that we take at a personal level will determine the outcomes. The outcomes will be determined by factors such as, are these services provided for every child? What is the individual family commitment? What choices are the families and caregivers making? And what are the community circumstances? There is therefore the government responsibility to provide and create an enabling environment for the provision of goods and services, and there is a responsibility of the individual family and the community in accessing and acquiring and using these goods, services, and resources in a responsible manner. This then is what will inform the outcomes, and when the better we do this, the more we see a more equitable society where we are responsible for the resources that we have been given in the vein of equal services and resources for all children in Kenya. So let's look at the I. Remember we said ECD, E for equality, C for community inclusion, no child left out. And that is the principle that no one is left behind. This belief begins with a belief that every child belongs. It means ensuring that children from displaced families, from low-income households, or those living with disabilities are not just present in our programs. It's not enough to see a child with disability on stage or in your classroom or in the clinic. That's not enough so that we can tick and say, yes, we have included them. They need to be actively welcomed. They need to be supported, and they need to be celebrated. A truly inclusive ECD system must be rooted in the community. It must involve parents, caregivers, elders, and local leaders as partners. The nurturing care framework reminds us that parents and families are the most critical caregivers. An inclusive ECD system must therefore recognize the parent as the bearer, primary carer, and one who has ultimate responsibility of the child. And the parents should be supported with government and private services to bring up the child. At the same time, an inclusive ECD system must seek to understand what are the local traditions, while ensuring that harmful practices are addressed with compassion and education, because we know not all local traditions are beneficial. We can't say we are going to do this because that's what our culture does. Some things are very good and must be promoted. Others are harmful and must be addressed. But how do we address them? With compassion and with education. When every child is seen, every voice is heard, and every family is engaged, we build systems that reflect the true heart of the nation of Kenya. And now let's look at the D. E was equality, C was community inclusion, and the D is diversity. Every child has value. Not to be seen as small identical pieces of a state or community machinery. They are not small identical pieces. Each of them has their individuality that we must bring out, that we must nurture. It means supporting children with disabilities, chronic illness, trauma, or developmental delays, attending to their particular and unique needs, and providing opportunities for integration in the community. It means also addressing those who are normal. We are not going to normal, and that is in quote, because every child is not abnormal, every child is not a mistake, every child is normal. But we must address every child. When we affirm every child's value, dignity, and worth, regardless of their background, social status, physical appearance, or ability, we create a future in which every child has the opportunity to flourish. So friends, we are here to improve access and quality in early childhood development. And if so, then equality, community inclusion, and diversion cannot be afterthoughts. They must be the foundation. This requires strong political will. It requires committed investment. And above all, it requires us, you and I, to become champions in our own roles in the homes, communities, care centers, schools, the clinic, the county office. The Africa Early Childhood Network congratulates ECD on hosting this important conference and applauds their continued leadership in ECD advocacy in Kenya. As a regional platform, AFCAN remains committed in advancing early childhood policies and investments rooted in the nurturing care framework and grounded in equality, community inclusion, and diversity. We value our partnership with the ECD Network of Kenya as we work together to expand opportunities for every child to grow and thrive. Thank you very much, ladies and gentlemen.
Thank you very much, Madam Gitonga, for that very powerful speech. We'd like to acknowledge the AFCAN, the Africa ECD Network, for the great work that they're doing continent-wide to ensure that ECD is a priority across the continent. I would like to invite another keynote speaker, Dr. Nelly Otube, who will be speaking on behalf of Professor Paul Wainaina from Kenyatta University. She's a senior lecturer and the Deputy Dean for the School of Education and Lifelong Learning at KU, who is concerned about physical and multiple disabilities, assistive technology, and inclusive education. Please take the stage, and you have about 10 minutes. Thank you.
Cabinet Secretary, Ministry of Health, Principal Secretary, State Department for Children's Services, Chair Council of Governors, and Governor Wajir County. My name is Dr. Nelly Otube. I'm currently serving as the Deputy Dean of the School of Education at Paul Wainaina